achieving integrated care or clinical integration really is essential to most of the strategies now that are focused on improving the overall quality and efficiency of care, particularly for those who have chronic conditions and more than just the episodic need to indulge the healthcare system. The VA healthcare system is a centrally administered, fully integrated system that's both funded and care is provided by government and employees. And it's actually the only national system insofar as there are VA facilities in every state, every significant metropolitan area, as well as in a number of places outside of the United States, such as Guam and Samoa and the Philippines, other places where there are significant populations of U.S. veterans. The population that the VA serves is significantly older than the U.S. population. It is much sicker, poorer, less well educated, and there is an especially high prevalence of multiple chronic conditions, and ergo one of the reasons why integration of services was so important, because of both the disease burden, the number of comorbidities, as well as the social needs of many of the beneficiaries served by it. In 1994, there was surprising unanimity of agreement about the problem list. Care was quite fragmented, uncoordinated, it was very hospital-centric and specialist-based, often long distances, long waiting times to get care. Quality was, I think, charitably irregular and unpredictable. The organizational culture was highly punitive, risk-averse. Leadership often changed and was selected for reasons often not related to healthcare competency. Overall, everyone was unhappy, and there was no agreement about how to fix the problem. And the vision that was espoused at that time was focused on improving quality, providing a seamless continuum of care, and one in which it was easy or clear to document that it provided superior value and that care really was patient-centered. We wanted to increase accountability. We wanted to integrate and coordinate care. We wanted to improve and standardize high quality so it was predictable and consistent throughout the organization. Modernizing information management was not necessarily a goal in and of itself. It was a tool or a means by which we could accomplish these other objectives. And then finally, the last was simply to align the finances with the desired outcomes. Some of the major elements of the transformation included creating a new management and operating structure to increase attention to population health, to implement universal primary care, put in place a new performance management system, implemented a system-wide electronic health record, and implemented, importantly, a new capitation-based global payment system that focused a lot on decreasing hospital use, increasing ambulatory care capacity, moving care out into the community whenever possible, established a national formulary more as a quality improvement method than as a cost control mechanism, and did a number of other things, but I think you get a sense of some of the major strategic efforts that were put in place. And I guess before I go further, I should say a word about what is integrated care. And I think the three key words are comprehensive, coordinated, and continuous. The first observation I would note is that achieving integrated care is more a sociological phenomena than a technological one. And as we think about how we achieve this, we really have to think about some new ways of thinking, some new competencies if this is going to be successful. There's no single pathway or universal model to get to integrated care. There are common aims, but those really have to be tailored to the local circumstances and conditions. A third observation is the essentiality of having strong clinical leadership, to be the bridge between the boardroom or the governance and the front line and vice versa. Leaders are the ones who have to prioritize and make the choices about what we focus on today, what we focus on in the short term versus the long term. The fourth observation is simply that finances have to be aligned with the desired outcomes. Integrating care requires new tools and an enabling infrastructure. One of the areas where I think many systems fall short in trying to integrate care is that they expect people to perform in new ways and have new competencies, but they don't invest in bringing them along to the point where they have those skills and they have those competencies, which certainly in the clinical arena, they've never gotten anywhere in their training. But it's only going to be effective, those tools will only achieve the benefit if in fact they are embedded in a culture of collaboration and quality improvement. Strategic communications plan is an essential part of this. It's one that is almost universally overlooked. But whenever one is embarking upon a major change effort of any type, including trying to integrate care, there is need for strategic communications. A seventh observation is simply that if one really focuses on and achieves integrated care, there will be a need to restructure one's assets. This is perhaps code for meaning less hospital capacity and more outpatient or ambulatory care capacity. In many communities, hospitals are sources of identity, community identity. And when they lose their hospital, they feel like they lose their vitality. And so in thinking about this restructuring, we have to be mindful that there are other roles of hospitals than just healthcare. A point that I think I've already made is understanding that healthcare operates as a complex adaptive system, which basically means you can't specify and dictate the change the way that you would in a more linear manufacturing model. There will always be unintended consequences. It is something that has to be recognized and it has to be designed into the system to understand. And likewise, there has to be a course correction mechanism built into the strategy because it is certain that one will have to make course corrections. And finally, the last point is simply that it's hard work. It always takes longer than one would hope, which is one of the reasons why, at least in my approach, we set very aggressive timelines, knowing that they're always going to take longer than one hopes, just because it's not as easy as one might think. With that, I thank you for your attention, and we'll move forward, I guess, to questions.